fact is that medicine is the leading cause of death in North America, and medicine has nothing to do with health.
So as you are establishing new ground, it's all about transformation. It's all about reformation.
I can't even tell you how much I finally feel like the real me is starting to show through.
Oh, back up. Get back in the race.
We want to really see a reformation and a transformation in health in all of Africa.
There's no virus that's going to get you down. There's no bacteria that's going to get you down. Nothing. Your body's going to overcome that.
Right now, simultaneously, there's about 22,000 people going through this event with you, all over Canada, all over America.
All these principles, just like gravity, they're all needed. You add these in. This is the foundation.
We not only want to bless you with knowledge, we want to bless you with action.
Hi, this is Dr. Dave Yachter, the chiropractor, Maximize Living Doctor here in Plantation, Florida. Just want to talk to you a little bit about the current events coming up here for November with National Diabetes Awareness Month. We're going to be hosting our Diabetes and Blood Sugar Control Workshop coming up on Monday, November 7th. So please get that dialed into your calendar. Very, very important. Also, we have the webinar, Diabetes Injury versus Disease. And so we'll be talking about the cause of diabetes with that and really how to prevent that. That's going to be coming up on Tuesday, November 22nd, so you can register for that online, ask for directions or information at the front desk on that, but that webinar is going to be Tuesday, November 22nd. Again, diabetes is at epidemic proportions right now. You may be watching this video, you might have diabetes, you probably have loved ones, friends, family members that have diabetes. It's nearly half of our American population is affected by the disease. Every 20 seconds someone's diagnosed with diabetes. Last year, 1.9 million people were diagnosed with diabetes. Nearly 20 million people have diabetes right now as we speak, and another 79 million are unaware that they even have it. They're pre-diabetic. Type 2 diabetes was once known as adult onset, if you remember, but kids as young as 5 now are being treated with prescription diabetes drugs. So that means that it's conquered literally all ages now, and the annual number of childhood diabetes diagnoses that we're seeing today is now fast approaching that of adults. So for the first time in history, we're going to start seeing adults outlive their children, and hopefully we'll get to the cause of that before that happens, but that's the trend that's actually happening right now. If you are diabetic, or family members, loved ones, understand this, that if you're diagnosed by the age of 30, the total lifetime cost of treating that diabetes will exceed $305,000. That was determined recently at American Diabetic Association conference. So that's literally hundreds of thousands of dollars in sick medical debt that's occurring to vast numbers of people, which again is preventable and curable with proper lifestyle. And again, if you have diabetes, your risk of death from heart disease or stroke is 2 to 4 times higher than the next person. 75% chance you have high blood pressure. It's the leading cause of blindness, kidney failure, and periodontal disease. And again, it doesn't have to be that way if we only learned how to correct the cause, the source, and the root. And that's why we're going to be focusing on the 5 essentials: nutrition, exercise, max mind, detox, proper nerve supply. These are all the essentials that we need to remove the cause, the source, and the root of why the body isn't functioning properly. So when you're just treating effects, you're concentrating on lowering blood sugar by raising insulin levels. What does this? Medications like glucagon, glucophage, shots, injectables, insulin pumps. And when you're doing that, you're actually worsening the cause of diabetes because you're not correcting the cause. So we'll be covering how to stabilize blood sugar by correcting the cause, utilizing some of the things like the healing diet, eliminating grains, sugars, certain fruits, adding good fats, adding the right protein sources like perfect protein, which is something I personally use myself to control my blood sugar levels, especially early in the morning when I want my energy levels to be consistent. After my workout, I have that. It's grass-fed, naturally raised, without antibiotics, hormones, chock full of antioxidants, amino acids to build muscle and strong, healthy bones. I mean, it's just a phenomenal, really nature's best source of protein that you can get bang for the buck. And you mix that with a little bit of fruit, some berries. Sometimes I'll put a little bit of fruit in there, and also some coconut milk or almond butter. And what I have found and what I've learned, from the world's elitist athletes, the most elite athletes on the planet will tell you this, that when you have those good fats, you will ride on that energy-wise always a lot further and a lot longer than you will on sugar. And so we're going to talk a little bit about that, how to use these things, how to use this technology to stabilize your blood sugar. But I would say even more important, my experience as a chiropractor has been essential number 2, which is proper nerve supply. I had a patient who, I'll never forget, she came into my office, it was probably about 15 years ago, and her name was Georgia. She came in, she was bent over, and she was just in so much pain, I'll never forget. And she asked me if I could help her. Her back was killing her, and I took her in the back, and we got an x-ray on her, and I could see on the x-ray that in the middle part of her back, the bones were just wrenched and shifted, choking and crushing the nerves in her mid-back. So I just figured that's probably what was causing her back to hurt. And you know, we got her adjusted, we got her on the table. You know, when she went to go lay on the table, I noticed she was wearing an insulin pump, and I didn't think much of it. But we got her down on the table, we adjusted her, she got up. You know, a minute later, I noticed the insulin pump. I look in her chart, she's been diabetic for about 40 years. So I didn't think anything of it, and I let her go. I told her to come back the next day so I could just check up on her after her adjustment. And about an hour later, somebody runs in off the street telling me to call an ambulance. That my patient who just left my office an hour ago, she's passed out in her car, that I need to call the ambulance. She's been there for the last hour. So needless to say, I was concerned. I called the ambulance, and I went out there, and it occurred to me that she was diabetic. Maybe it was her blood sugar levels. So I went and I got some juice, orange juice. I brought it out, I put it on her lips, and she started coming to. Then the ambulance came and took her away. And you know, that was it. It was all I could do to go home that night and keep myself from getting depressed and discouraged. I couldn't understand what happened. I mean, I gave her an adjustment. It seemed like she was doing great. She stood up straight. Immediately, she started to see results. But then she goes into the hospital. It just didn't make sense. So, you know, I woke up the next day and I was studying the x-rays, and before I know it, Georgia came in, and she's standing at the front of the office there while I'm taking care of patients, and she's asking to see me. And I got a little concerned. I got a little worried. I didn't know what she was there for. And as soon as I was done with all of my adjustments, she walked over to me, and she wrapped her arms around me and started hugging me. And she stands back and says, "Dr. Viagter, I don't know what you did yesterday, but I haven't slept this good and felt this good in 40 years. Can I have another adjustment?" I said, "Yes." And I was relieved. I was kind of anxious. I didn't know what was going to happen there. But I took her back, and I showed her on the x-rays that the same bone that was out of alignment, pinching and choking the nerve that was causing her back to hurt, was the same nerve that was feeding off to her pancreas. And for the first time in 40 years, someone went there and opened up the nerve channel so that the life supply, the nerve supply, the proper nerve supply, could feed off to her pancreas. So when that adjustment happened, that's exactly what happened. We turned her power on, so immediately her pancreas started making insulin. It started functioning properly, but her pump was still on, so she got too much. And that's why she passed out in the car. And I know this to be true because she felt so good, she was doing so well, she didn't stop coming in, she kept coming in, day after day, week after week, month after month. As time was going on, her endocrinologist started reducing her insulin requirements. She went from 8 units down to 6 units, 5 units, 4, 2, 1. She went from 8 units to 0.8 units in 5 months. 67-year-old brittle diabetic. At the University of Miami, her endocrinologist never saw anything like that. So they call her up, they have her eligible for a special study. He calls me up, he wants to know what my clinical protocol is. And to me it was pretty simple. It wasn't anything special other than finding and removing the interference from what was stopping her body from functioning the way it was created to in the first place. And as we always say, you know, the body doesn't need any help, it just doesn't need any interference. And if you've got bones out of alignment, pinching and choking off vital nerve supply to important organs and tissues, it doesn't matter how good you eat, how much you exercise, all that stuff is virtually worthless if you've got a malfunctioning nerve system that's short-circuiting and causing disease to spread from the spine out to the organs. And so that is crucially and vitally the most important essential that we want to make sure that everybody is checked for. And that was a life-changing experience for me. So that's the most foundational component that we build upon with all the other essentials, that proper nerve supply. So I'll tell you, you know, I've been blessed being a chiropractor here for so many years and seeing all these people's lives change, you know, just through that. But then when you add all the other essentials on top of that, with the detox and the nutrition and the exercise, Max Minds, my goodness, I mean, we truly do have an amazing health care delivery system that will radically change people's lives around the world. And so I want to invite you once again to make that commitment to be here at that workshop, because it literally is going to be a life-changing event. So really, the only question that we want to know is, who are you bringing? Who else do you know? that needs to get healthy, that needs to prevent sickness and disease, and wants to have the life and the health of their dreams. So just think about those loved ones, families, and members and friends who need to be here with you. Seating is limited, so make sure you stop at the front desk right now and just get yourself and everybody else scheduled that you want to be a blessing to. Also, our Thanksgiving food drive is going to be the following week, Monday, November 14th. So we want to remember everybody in need at this time. It's the season to start giving, so make sure everybody starts gathering up those cans of food and brings them to the Patient Appreciation Day on Monday, November 14th. And then last but not least, again, just remember that we have the webinar on November 22nd. So maximize living patients, doctors, staff, I love and appreciate you. God bless.